Good evening, folks. Tonight's topic D is the speech that I made for y'all. The speech is titled The Fall That Should Not Break a Bone. This address is on fragility fractures. Okay, so with that being said, let's go into the speech that I made for you. Please enjoy. Ladies and gentlemen, colleagues, community leaders, thank you for gathering today to talk about something that is both profoundly common and profoundly overlooked. Fragility fractures. These fractures are not simply broken bones, they are warning signs, quiet incidents, and often missed that tell us the skeleton is losing strength long before anyone realizes it. Tonight, I want to explain what fragility fractures are, why they matter, and why recognizing them is one of the most powerful tools we have to protect independence, dignity, and health in an aging society. What a fragility fracture really is. A fragility fracture occurs when a bone breaks from a force so small that a healthy bone would not break. A fall from standing height, a twist while reaching for a cupboard, a bump against a countertop, sometimes even a cough. These are low energy events. They should not break bone. When they do, the bone itself is the problem. A fragility fracture is not an accident. It is a biological event, a sign that the internal architecture of bone has weakened. It is the body whispering that something deeper is happening. Okay. The biology beneath the break. Bone is alive. It remodels constantly, balancing formation and uh, resorption. Fragility fractures occur when this balance falters. Inside the bone, the honeycomb like tubular network becomes sparse. The outer cortical shell thins, micro cracks accumulate faster than the body can repair them. Hormonal changes, menopause, testosterone accelerate bone loss. Chronic disease like diabetes, kidney disease, and rheumatoid arthritis weaken bone integrity. Medications such as steroids and auto, inhibitors erode bone density over time. By the time a fragility fracture occurs, the, the biology has been shifting for years. You can explore these mechanisms through micro damage in bone, humeral shifts affecting bone where fragility fractures occur. Fragility fractures cluster in predictable places. Hip, often life changing with high morbidity. Spine, compression fractures cause height loss, stooping, chronic pain. Wrist, forearm, frequently the first sign of osteoporosis. Shoulder, proximal humerus. Pelvis, increasingly recognized as major indicators of bone fragility. One fragility fracture doubles the risk of another within 2 years. The skeleton remembers why fragility fractures matter. Fragility fractures are among the strongest predictors of future fractures, loss of independence, hospitalization, long term care admission, increased mortality, hip and spine fractures, in particular, carry serious consequences, but even wrist fractures, often dismissed as minor, are early warning signs that the skeleton is already compromised. Fragility fractures reshape lives. They change how people move, how they feel, how they trust their own bodies. They narrow the world. Why fragility fractures are missed. Despite their significance, fragility fractures are routinely overlooked. Emergency departments treat the break, not the underlying disease. Primary care visits focus on the injury, not the biology. Orthopedic surgeons repair bones, but are not tasked with preventing the next fracture. Electric health records rarely flag low energy fractures as indicators of osteoporosis. Insurance reimbursement rewards acute care, not prevention. The result is a national pattern of missed warnings, an, epi- an epidemic of hidden bone disease that goes undiagnosed until the next fracture forces the issue. The human story behind science. Let me tell you a story. A woman falls in her kitchen and breaks her wrist. She is told it is just a fracture. Months later, she develops back pain from an undiagnosed vertebral vertebral compression fracture. Her posture changes, her mobility declines, her confidence erodes. She stops gardening. She stops walking to church, stops carrying her grandson. Then she breaks her hip. The sequence is not inevitable, it is the result of missed warnings. Fragility fractures are not isolated injuries, they are sentinel events. The first chapter in a story that can be rewritten if we act early. What should happen after a fragility fracture? A fragility fracture should trigger a systematic response: bone density testing, osteoporosis evaluation, review of medications that weaken bone, fall risk assessment, nutrition optimization, pharmacologic therapy when indicated, secondary fracture prevention programs. These steps are not complicated, they are simple, simply not done. The call to action: fragility fractures are one of the clearest, most actionable opportunities we have to improve health outcomes for older adults. They are measurable, trackable, and responsive to interventions. Intervention. Recognizing fragility fractures, truly recognizing them, could reduce disability, prevent hospitalizations, lower costs, preventative, preserve independence, strengthen families, support aging in place. A fall from standing height should not break a bone. When it does, it should change the course of care. Fragility fractures are not accidents, they are signals, they are early warnings, they are opportunities for intervention that our health system routinely misses. If we learn to listen to these warnings, if we treat fragility fractures not as isolated injuries, but as messages from the body, we can change lives, we can protect independence, we can prevent suffering, we can build a health system that sees what has been invisible for too long. Thank you. Okay, guys, that is your D. Um, I will I will see if I can jump on in a few minutes and do a next one, which will be E tonight. So give me a few minutes, please, and I will see if I can get another one done for you. For now, Gator Wellness, take care, folks.